How are you today?
I'm good. How are you?
Good. Welcome into the clinic. I'm just going to get started today with our appointment with some questions, get an idea of what we need to do at the end of the appointment. Okay?
Sounds good.
Okay, great. So, what is like your main reason for coming in today? What is your end goal before you leave with us?
Well, I've noticed that I've been having some hearing difficulties, specifically with my grandchildren, and when I meet up with my girlfriends at the coffee shop.
Yeah, well, that's never any fun if you can't hear them. Okay, and then, have you had a hearing exam before?
Not that I know of.
No. Okay, good to know. And when did you start noticing that you were having trouble hearing your grandchildren and your girlfriends?
Over like the last 10 years.
Okay, so it's been a little while.
Yeah.
Do you think it's become a little more gradual over time, or has it just been about the same?
Just a gradual decline.
Okay, good to know. And have you ever worn hearing devices before?
Nope.
No. Okay. And just to kind of get an idea if there's a difference in your ears, kind of generally, do you typically use the phone on a certain ear? Do you have a preference when you're talking?
I'm right-handed, so
you
probably
think
the
it's
right.
just that? And do you ever put it on speaker to hear better, or do you typically listen through the phone?
I just try not to use the phone because I really struggle a lot with it.
Okay, that's good to know. And within the last 90 days, I know you said within a few years you've noticed this, but within the last 90 days, has it seemed any more progressive or sudden in your hearing loss?
No.
Okay. And have you ever had ear surgery before?
No.
Okay, good to know. And are you experiencing any pain or discomfort in your ears?
I get some pressure.
Pressure? Is it in one or both?
Just in my left.
Just in your left. Okay. And have you had chronic ear infections in the past?
I don't know.
You don't know?
I was adopted, so I don't know.
Okay. In your adult life, have you had any ear infections?
No.
Okay. Well, that's good. Do you notice that your ears produce a lot of wax?
Yeah.
Yeah. Good to know. And have you had any trauma to your head?
Yeah.
Okay. Can you describe maybe what that was?
It was a car accident and I hit my head on the windshield, but
Oh gosh.
I don't really remember anything else.
Fair enough. And currently you said they feel full and just pressure in your left ear, correct?
Yeah.
Okay.
But it's not really painful, it's just kind of
Just
there.
Okay. And is it constant? Does it come and go?
It's there all the time.
Okay. Any dizziness related with that fullness?
I don't know if it's related, but yeah.
Okay. Is it all the time?
It's pretty much just when I stand up
Okay.
too quickly.
And are you noticing any ringing in your ears or a funny sound kind of in the background?
Yes.
Good to know. Is it all the time, or do you notice it like when you go to sleep?
I've noticed it for a long time, at least over the last 10 years.
Okay. And do you have a family history of hearing loss at all?
Yeah.
You do? Do you know if it was like on your mother's side, father's side?
It was my parents and my older sister,
Okay.
but I think it was like later in life.
Okay, so maybe age caused.
Yeah.
Okay. And do you have any history of cancer, kidney, diabetes problems?
Yes, I've had breast cancer
Oh gosh.
and high blood pressure.
Okay.
I stopped getting chemo like 5 years ago.
Okay. While you were having chemo, did you notice any like hearing change then, or has it been since then?
Considering I've noticed a decline for the last 10 years, I would say definitely maybe more so during that
Okay.
5 years.
And do you have a pacemaker at all?
No.
Okay. Do you get frequent headaches?
No.
Have you been exposed to like excessive noise levels in your workplace?
Well, I'm a teacher, so
Just kids mostly year
Yeah.
round. Okay. Have you been around firearms? Do you go hunting at all, or did you?
yeah.
Yeah. Okay. How long did you do that for? Are you still doing it?
Yeah.
Great. Do you do like yard work without hearing protection?
Yeah.
Is it more?
I mean, I didn't really know it was a thing.
Yeah, definitely. Is it more gardening or are you using power tools?
Lawnmower.
Lawnmower? That'll get you. Okay. And I see that you're wearing glasses. Without
Yeah.
glasses, do you, are they like a strong prescription or do you feel it's just for daily?
I wear them every day.
Every day. Okay, good to know. And how are you, like, what are your thoughts about hearing aids? How do you feel about them?
I mean, I feel like my hearing has changed, but I don't really want anything that's going to be too noticeable because I like to wear my hair up and
Okay,
I'm just, self-conscious about it.
understandable. And in your home life, who are your main communication partners?
My dog, and my partner.
Okay, great. Okay. And is there any other environments outside of, coffee house or things like that that you wish you could hear better, or is it mainly just those?
Those are my main ones because I really like spending time with my family and I feel like it's a struggle to communicate with them.
Okay.
I'm retired now, so work isn't so much of a problem,
Right.
but I do want to have a social life.
Very important. Okay, well, Amy, I think I have a lot of information that I need to get started on testing. Do you have any questions for me before we get started?
Will it hurt?
No, it should not cause any pain. None of the things we'll do will hurt you.
Sounds good.
Okay, well, let's get started.
All right.